Hi, I'm Morse, the founder of Core Elements Training. In this video, we're going to demonstrate vacuum dry cupping to the wrist flexors and the wrist extensors. This is a great area to cup if your client might be experiencing generalized pain around the elbow or restricted range of motion around the wrist joint or possible carpal tunnel, for example. Or your client might just have a lot of tension in the wrist flexors or the wrist extensors as a group. If your client had generalized elbow pain, they may have a condition such as medial or lateral epicondylitis. And in either of those conditions, we're going to try to reduce muscular related tension in the wrist flexors as a group and also in the wrist extensors as a group, because those two muscles are opposing to one another. And if you've got a problem on one side of the joint, you've probably got associated tension or weakness on the opposing side of the joint. Okay, so we need to apply our medium first. The medium that I'm using today is lotion, and this is lotion from Physique, but it doesn't matter which medium you use. You could use oil or you could use wax as well. So whatever you normally use within your clinic. Because we're going to do static cupping along with some movement techniques, you do need to apply medium first in order to help to reduce some of the friction that will occur with the technique, but also this enables the cup to create a seal and more suction as well. Okay, so I'm going to apply the medium to the area. Okay, so I'm going to come into both sides of the joint here. It doesn't need to be fully absorbed. Absolutely, you could spend more time massaging the area and helping that medium to absorb slightly. But as long as we've got that base medium onto the tissue, then that's going to help with the seal. Okay, so we're going to put the cups on statically first. The cups that I'm using today are the Dongbang cups. Okay, and I'm just going to bring this trolley around slightly. Okay, so I'm placing the cup directly onto the tissue. I'm placing the cups where I feel more of the tension. Okay, so I'm going to place that directly into the middle of the joint. This one here, it might stick, but just assess the size of your client, and that's going to help to dictate which size cup you use. You can see that this cup has created that seal, but it's just on the cusp there. I might want to use a slightly smaller cup. So in this small area, we'd want to leave the cups on statically first for a short period of time, maybe 2 to 5 minutes, depending on the colour of the tissue inside the cups. Now, the more tension and the more the tissue is used, the darker those cupping marks might be. Okay, if your client has muscular weakness and they don't use the muscle tissue as much, then the cupping marks might not go as dark. Okay, so before we do any of our movement techniques, we would leave these cups on statically. So I might place these cups on here first and go to a different part of the body whilst I might be doing cupping on another area or manual massage on another area as well. Okay, then what I'm going to do is we're going to move into the soft tissue release technique, or the cupping version of soft tissue release. So I'm going to take these two cups off first because we want to place the cups on when the muscle is in a shortened and relaxed position. Now, to enable the muscle to be in a shortened and relaxed position, we want the therapist to be moving the joint into wrist flexion. Now the muscle is relaxed, but it's also short. Okay, then what we need to do is we need to keep the wrist in this position whilst we place the cup on. Okay, so I've got one cup on. Now what I'm going to do is just place my pump into the top of the cup there, so I can lift my second cup on. Okay, then we might get that third cup in place as well. So I'm just going to lift the cup up so I can get it into my pump, and in we go. Okay, now from here, I'm just going to take this bolster away slightly. Okay, and then we can relax that arm down, and now passively we can move it into wrist extension and wrist flexion. One often comes off as soon as we start moving. That's fine. We're going to continue with that movement because we've still got 2 cups on there, and we're still going to be getting a stretch effect, okay, and inside those cups, because these cups have put the tissue into a stretched position. Then what we're doing by moving the wrist joint is we're taking it into a further stretch, and that double stretch effect is going to trigger a relaxation response within the muscle tissue. Now I'm going to give the client the weight of the hand, and she's going to continue with that wrist flexion and that wrist extension position. Okay, then now that she's doing the movement herself, we're going to get a synergistic response, because every time we contract our muscle, we produce heat as a waste product. That heat helps to produce a relaxation effect in the muscle, but also by using the muscle tissue as well, we're increasing that internal blood flow. So we're getting that increase in blood flow from the cup, but also that increase in internal blood flow as well. So generally 3 to 6 will then help to relax the tissue. Then what we could do is we could repeat this again, because one of our cups came off. So from here, I'm going to hold her wrist in that shortened and relaxed position. Then I'm going to place that second cup on. Now it might stay on this time. I say might, they sometimes come off again. Okay, but because we've already reduced some muscle tension, okay, in the wrist flexors, but with 2 of the cups, the third cup might stay on this time. So I'm going to go back into that movement passively. Oh, and now we've lost a different one. That's fine. Okay, we're going to keep going. And then the client is now going to, again, take the weight of her hand herself. Again, releasing further muscular related tension. If the client was experiencing pain, this will also help to reduce pain sensation. Okay, so generally, again, as a rule of thumb, 3 to 6 repetitions, but if they've got really restricted movement, you could keep going for 10 or even 12 repetitions as well. Excellent. Thank you, Katie. Okay, now we're going to take these cups off, and we're just going to palpate. So it's always useful to palpate in between, just to feel how much tension has been released. That's then going to help to inform what you do next, whether you follow up with further manual massage or whether you follow up with a different cupping technique. This time we're going to do active movement. Okay, so active movement, again, Katie is going to do wrist flexion and extension, but this time I'm going to be sliding with the cup. Okay, so cup's going to go on when the wrist is in that neutral position. I'm just going to test slightly to see whether I can move that cup. If I have to yank the cup to get it to move, it's too tight. If it moves really easily, then it's too loose. So we want that happy medium, some friction, but not too much. And then from here, Katie again is going to flex and extend at the wrist joint, and I'm going to slide. Okay, so small sliding movements are useful here because normally these fibers are really adhered. And as we reduce some tension, then we might be able to get a bigger slide effect. Okay, making sure you're communicating with your client to make sure you're working within their pain or their discomfort zone. If it's painful, they're going to tighten up. So it can be uncomfortable, but as long as they're still breathing, they're not holding their breath and they're tolerating it, then that's fine. Okay, so this is our active movement technique. Client is moving, wrist flexion, wrist extension, and I'm sliding with the cup at the same time. Okay, so just to summarize what we've done on the wrist flexors as a group. Okay, static cupping into soft tissue release, where we put the joint into the shortened and relaxed position so that the muscle is short and relaxed. And then we put the cups on and we actively and passively went into wrist flexion, wrist extension. Okay, then we did active movement, so the client is moving at the wrist as you are sliding with the cup. We could do all of those techniques on the opposing side as well. Muscle group on the opposing side, the wrist extensors as a group, tends to be smaller, so we will want smaller cups on here. Okay, so I'm going to grab a couple of the smaller ones. So the muscle tissue is broader as we get nearer to the elbow. We can hear there, it has just about created that seal. Oh, it's on the cusp. Okay. So you can hear the air coming out there, so that's not going to create the seal. Okay, so you've got one cup there and one cup there. Okay, so the cups are on nice and statically. Remember, we might start with that static cupping first, leave that for a couple of minutes while we might be working on another area of the body. This is helping to reduce some of that superficial tension. Okay, and then after this, we could come into our soft tissue release technique and our active movement technique. We could just go purely into straight sliding instead of doing STR or active movement. And our straight sliding technique is quite nice here. Again, we need to make sure we've got enough medium onto the tissue. So I'm just going to take that top one off first. I'm going to use the smallest cup, sometimes referred to as the trigger point cup. Okay, and from here, Katie is now going to stay static. She's not going to move at all. And I'm now going to slide that cup along the muscle tissue. Again, small slides. And then once we've reduced some of that tension, I'll just show you with my other hand, small slides. And then we can go into those larger slides. The nice thing with doing the movement techniques when the client is moving the associated joint is that it triggers that neural response as well. Okay, so we get that neuromuscular release. Okay, so straight sliding, it's literally just reducing that muscle tension. We're producing a nice amount of erythema here and helping to increase that localized blood flow and muscle efficiency. Okay, so that's a demonstration of static cupping, soft tissue release or cupping soft tissue release, active movement and straight sliding to the wrist flexors and the wrist extensors.